Right, it looks like it is 1:40, and so just for the interest of time, we'll go ahead and get started. I believe you will be kicking us off today as our moderator.
Great.
Awesome.
Welcome again. And just in terms of access and equity, I want to remind folks that we have closed captioning, real-time captioning available. There's a link in the chat, so please check that out if you need that resource or are just curious about it. So I am really excited to be presenting an awesome panel of friends around the goal number 4 in the master plan, Caregiving That Works. And I will say Erin and Lisa and their extensive expertise in the field of caregiving. Anna as well, who unfortunately won't be with us, will be doing her portion of the presentation. But they all really embody the spirit and the passion of what caregiving means, because it's more than a vocation. It's really a commitment to love, to support, to family, to the health and safety of our older adults, of people with disabilities, of people aging into disability. And as we will hear, through this presentation and through the panel, it is one of the most underappreciated and underrepresented and under-resourced sectors of our workforce. So let's go to the next slide. So as I mentioned, Erin Alicorn, the Executive Director of the Public Authority in Marin County. Anna Kachatrian, who works with us here at Marin Center for Independent Living as our Community Care Administrator, unfortunately is not able to make it. I'll be serving in her place. And then my friend Lisa Brinkman, gerontologist with the Senior California Assembly, and also former director of Marin Villages. Next slide. Okay, who's kicking us off?
I can kick us off. I think one of the things that we want to acknowledge during this presentation are some of the major home care options. There's a lot of other ones besides the 3 that we have listed here. And because of the time allowance, we're not going to be able to dig too deep into most of them. But there are different home care options. We have the home care agencies. We have home care registries. We have informal caregivers. Obviously, there's assisted living facilities, there's senior housing, and there's also undercurrent resource of independent people who give home care during that within the community. We're going to focus on the registries, what Marin County's doing, and some of the resources that are available there. I'm going to speak to the informal family caregivers and how the Master Plan on Aging can hopefully give us some relief. Next slide.
The one before, please. Thank you, Lisa, for this introduction. And just to complement what you said about the types of caregiving that is in our state particularly, I would go a little further and say that from funding perspective, there's 3 sources of caregiving. One of them is the informal caregiving provided by a family member or a friend that a lot of the times is free. The other is the private caregiving that is offered by individual providers or by home health agencies. And then is the public funded caregiving, which in California is called in-home supported services, which is a medical-based program. Probably a lot of you guys are familiar with in-home supported services, but I'm going to give a little bit of introduction, a little bit of summary, what in-home supported services is and why it is very important in our community. I represent, as Eli mentioned, the in-home supported services public authority, We are an independent agency from Marin County, which can somebody please move the next slide? But before I go into the public authority, let me rewind a little bit and give you a little bit of introduction. Yes, no, that one. Thanks. No, the one before. Yes. Let me give you a little bit of an introduction, like I said, about what in-home supportive services is. In-home supportive services is a welfare program, it's an entitlement program that is medical based, which means that in order to be eligible for in-home supportive services, the recipient has to qualify first for medical. And we all know that medical, for the most part, is income based. And there's some exceptions for people that have a disability. In those cases, individuals can receive in-home supportive services even if they are not low income. In-home supportive services, like the PowerPoint is rightfully stating, it provides personal and domestic care to people that are aging, blind, or disabled, so they can remain at home. And that is something very important for in-home supportive services, that we need to understand that the purpose of in-home supportive services is to avoid institutionalization, meaning avoid that the recipient ends up in a nursing home or a hospital or even a group home, because the purpose of the program is to create dignity and independence so the recipient can stay at home. Like we said, the medical eligibility has to be determined by each county. IHSS is handled or managed individually by each county in our state. And something very particular about in-home supportive services is that the recipient of the program is the employer. The recipient of the program remains independent in making the decisions about his or her own care. The county social workers assess the recipient. The assessment is not diagnostic based, but it is based on functionality, which means that not because somebody has, let's say, diabetes or chronic pain, that automatically is going to qualify the person for in-home supportive services. There needs to be a functional need, meaning that the person has to have some physical impediments to perform their activities of daily living. Next slide, please. Yes, Jesus Rosa just asked me that in order to qualify for IHSS, someone needs to qualify for medical first. Yes, the answer is there needs to be medical eligibility first. Now, who is the public authority? Like I said at the beginning, the public authority is an independent government agency from the county. We are governed by a board of directors, which I report to. And our mission, as you can see in our screen, is to empower IHSS recipients of our county to remain independent and safe by supplying quality in-home care providers for whom we select and support. And I want you to please pay attention to the last words of our mission statement, whom we select and support. When I joined the public authority 4 years ago, I did a focus group with stakeholders, etc., to come up with a mission that better reflected what the public authority does. What the County of Marin and in-home supportive services, their loyalty, for lack of a better word, remains to the recipients of the program. The public authority caters to the recipient. Obviously, they are the reasons because we exist. However, we also care about the care providers, because we believe that supporting the care providers is going to improve the services that the recipients enjoy. Our vision, as you can see, is we envision a world where all the IHSS recipients of Marin County remained independent and safe at home. Next slide, please. This is some of the things that what we do. We recruit a lot of our care providers. We keep a registry, which is pretty much a database of vetted providers that we personally interviewed, we personally selected. And what happens is that the recipients of the program that do not have a family provider, do not have anybody that is going to perform the IHSS authorized tasks, they come to us, the public authority, and they request a list. We send that list with 3 or 4 names of providers who could potentially work for them. And the recipient, once the recipient receives the list, then the recipient needs to call them, set up interviews, hire them, and manage them. Now, does this sound like something that somebody with cognitive disabilities might do? Does this sound like somebody that is bedridden might do? The answer is probably not. That's why the public authority is very concerned in making sure that the recipients of our program have the tools and the resources to navigate the IHSS system, because intrinsically, the IHSS system can be difficult to navigate. I mean, unless you were a manager in your career, unless you had the chance to hire people and to interview them and know exactly what questions you are going to make. Imagine if you're 75 or 80 years old and suddenly you have to go through those through that process. It will be terrifying. So that's why the public authority has come up with ways to help that population that has a difficult time navigating the IHSS system. We have a registry that we call it the expedited registry, in which the recipient gives us the opportunity to select somebody that, in our view, would work better with that person. We send that person. However, the recipient still has the choice to tell us, yeah, that person is not going to work. Send me somebody else. But if it works, great. That way, as I said, the recipient doesn't have to worry about making the phone calls, about interviewing, etc., which, like I said numerous times, it can be intimidating. We also have another registry, which is the on-call registry. In fact, Eli, I need to thank Eli because he and I started working on this registry years ago. We've met many times to talk about how important it would be for our county to have this type of registry, which is for recipients that suddenly the care provider doesn't show up to work. The care provider is sick. The care provider had a family emergency. And what happens with these recipients? A lot of them end up in the hospital. A lot of them end up calling 911 because they fall. They don't have anybody to cook for them. They don't have anybody to give them their medicines. So, you know, the silver lining of the pandemic. When the pandemic started, thanks to our Governor Newsom, there was a mandate that all the public authorities in the state should have an on-call registry. In other words, somebody that can immediately step up to, I'm reading a question, hold on. Immediately step up in the case that the regular caregiver of a recipient doesn't show up. The mandate of the state is to keep the on-call registry until December of this year. However, the public authority, along with Eli and other agencies in the community, are advocating so our county keeps the on-call registry permanently. Let me go to the questions here. Can a family caregiver be in your registry and be assigned only to his or her family members and thus get paid for his or her services? So the registry is for recipients that do not have a family member, that do not have a friend, do not have a neighbor. According to statistics, the percentage of those recipients out of all the recipients of IHSS is approximately 30 to 35%. The other 65% are people that have a family member. So to answer your question, a family member doesn't need to enroll in a registry, but they need to enroll as IHSS care providers. Yes, IHSS care providers. And in order to do that, the state has a process to register. We fingerprint them, we take background check to make sure that the individuals that are going to take care of our population are not going to harm them. So that's in a nutshell how in-home supportive services works and the difference with IHSS. Next slide, please. And now I'm going to give it to Eli, who's going to talk about the wonderful registry that his agency manages.
Thank you, Aaron. And I am not going to do as good a job as Anna, but I will do my best. And before I go into the work that we do at Marin Center for Independent Living on our registry, I really just want to spotlight who is on our registry. And those are individuals who are primarily persons of color, immigrants, women, individuals who do not make the cost of living, which in Marin County is around $28 an hour. Recognizing that when we talk about caregiving, when we talk about equity, the caregiver workforce is essential in terms of spotlighting and lifting up, both to sustain and support our older adults and people with disabilities and aging in place, especially during COVID, but as a greater equity issue around how we as a community value work and value care. And also we're talking about family caregivers. And this is highlighted in the master plan, which I know Lisa will cover additionally, but really recognizing that there is so much unpaid caregiving that's happening in Marin, in the North Bay, throughout the state. So Marin Center for Independent Living was founded 42 years ago. And one of our foundational programs was the Personal Assistance Registry, recognizing that people with disabilities, and our founders were young when they founded Marin CIL, they required personal assistance in order to participate in community living. Going to work, going to a party, accessing and having fun. Caregiving was essential. Also recognizing as the state evolved and public authorities came into place, that not everyone qualifies for in-home support services. Yet they might not be able to pay for private pay home health agencies, many of which are excellent, but there's this huge middle gap that lacks the ability to pay for care. So Marin Center for Independent Living's Caregiver Registry screens and manages approximately 150 to 200 caregivers every year. They really serve as independent providers. They have extensive experience, and Deborah, who I see on our screen, is one of our caregiver registry coordinators. We look for folks to match with an individual's unique needs and settings. And citing Anna, and I'm sure she would share this story if she was here, when we're talking about language and when we're talking about comfort level, Anna tells the story of her family, her mother, who is a person with a disability, and that their family immigrated from Armenia. And she was not comfortable till she found a caregiver who spoke her native language. And really recognizing that match, that connection between the caregiver and the individual is essential for success. As I mentioned, the consumer is the employer of record, and typically that's paid out of pocket. In some cases, if someone has a long-term care insurance plan, that can also cover it. But we would connect the consumer and the family with a payroll service if they needed help managing that. Next slide. So, one of the tenets in the master plan's goal on Caregiving That Works is virtual care expansion. About 10, maybe 12, I've been around for a while now, years ago, Marin Center for Independent Living innovated a new form of connecting individuals with caregivers called Quick Match. And the website, which I don't believe is in the slides, but I'll put it in the chat, quickmatch.org is a site that we manage, and we now actually license to over 7 different agencies throughout the state to provide a virtual connection to link with the caregiver. Essentially, what we're offering is a high-tech and high-touch solution, recognizing that in Marin, many families don't necessarily live with their older adults or their family members in Marin, but they need help finding that caregiver connection. So through Quick Match, we have individual profiles of all our active caregivers, as well as bios, trainings, and certifications, and what types of services that each caregiver offers, whether it's general activities of daily living, transportation, feeding, dressing, bathing, as well as kind of more unique situations, taking care of pets, driving to and from medical appointments. And this Quick Match virtual connection has really expanded significantly over the last year, particularly during COVID. As Aaron mentioned, he and I have worked many years in advocating for on-call registries. And over the course of COVID, Marin CIL also initiated an on-call registry, really a rapid response. What we found early in the pandemic was that individuals were not able to identify caregivers, or there was a lot of fear and misunderstanding about how COVID was spread, and really employing what we called our Delta Force, some of our most trained, experienced, and exceptional caregivers to kind of go in rapid response settings, in some cases, COVID positive environments, and perform, frankly, as heroes, as first responders. And that caregiver on-call registry continues today. Next slide. So just in terms of the emerging needs and what we're seeing in our community, over 70% of adults over the age of 65 will need a caregiver. And that's approximately 14% of our country's population, or roughly 4.4 million Americans. Next slide. And in the Bay Area alone, that accounts for over 150,000 seniors and people with disabilities. Next slide. I believe this is Lisa's slide, but I just want to end with, in terms of our registry and our work, one of the keys to effectively supporting folks in aging in place is partnerships. The public authority, the Marin Villages, Vivalon, many other CBOs that are on this webinar work together to identify folks who are struggling, who might not be able to get to their medical appointments, who might have been identified through a Meals on Wheels delivery as really not able to perform their activities of living, daily living, or at the county level, our IHSS social workers and adult protective services. And I think building a network of care, communicating, whether it's through the Aging and Disability Resource Connection, or the One Door as we call it, the Aging Action Initiative, which is our local advocacy coalition, as well as policy framework. We as a community need to lift up caregiving. We need to communicate as providers, as partners, as stakeholders, and we need to educate our elected officials, both at the local level, the Board of Supervisors level, and the state level, on the value of caregiving and pay for it. Increase the cost of living, increase what resources we can provide to caregivers, whether it's pay, benefits. There are so many opportunities we as a community have to lift up this profession. And I will pass it over to Lisa.
Actually, Eli, these are still Anna's slides.
Oh, okay.
I think you hit on most of the topics there, so good job. But you keep going for a little longer. These are all with regards to paid caregivers.
Great, thank you. And you guys let me know when they're no longer Anna's slides.
I just feel like I'm not as good with the chat.
So just driving the point home, more than half of our home healthcare workers have completed no formal education beyond high school. I will say that amongst our immigrant caregivers, many were medically trained in their countries of origin, but that transfer of skills didn't necessarily work because it required reaccreditation. Their education was not honored as they moved to the United States. 73% of home care workers are below 300% of the federal poverty level. And at a national level, that's a wage of approximately $10.49. And from 2014 to 2024, home care workers have been projected to add more jobs than any other occupation, approximately 633,000 new jobs anticipated. Next slide.
That's still yours.
Okay. So we talked about wages. Just touching on mistreatment, and this, really is a issue of equity and often racism, discrimination, as Erin pointed out. When we have a workforce that's predominantly BIPOC, and women, it's an opportunity for exploitation. Threats around immigration status, calling ICE, just general blame or accusation of stealing property frequently comes up. I think the key and what our staff, and I know Erin's and many of the providers in Marin really do and serve, is an advocate for the caregiver and the consumer at the same time, mediating misunderstandings, mistrust, cultural and language barriers. Often it's, especially with our older adult population, there might be stigma or fear of letting a person of color into their home based on generational racism. And I know that our team really works to mitigate that and kind of build trust and understanding. And typically within a few weeks, it's a BFF situation between the provider and the caregiver, but still recognizing that language, cultural competency, all of these issues are kind of mixed up in the secret sauce of making a good connection between a caregiver and a consumer. And I mentioned some of the technology barriers. I will say that many of our folks do not use or have access to the internet. And with, as Erin mentioned, the new electronic visit verification program, now that everyone is required to document their time electronically, both of our agencies are spending resources and time in supporting our caregivers and our consumers in accessing and bridging the digital divide. And in some cases, providing Chromebooks and laptops. Next slide.
I'm on now.
All right, take it away, Lisa.
Okay. Well, first of all, just as some background, my name is Lisa Brinkman, and I was the former executive director of Marin Villages. And in that capacity, I was challenged at times to help our members locate the right type of caregiving situations for them. So we did work closely with the Center for Independent Living. We called the county's info number often. We worked with the home care coalitions in Marin County for the agencies, and sometimes with the family, where we just would perhaps get a center for Lighthouse for the Blind, if there was a vision issue, to come in and review the house so that they could live a little bit longer by themselves. I'm also a court-appointed conservator for a woman in the city for both her personal and financial. So I've had to manage caregivers. And I'm currently a part-time caregiver for my mom, who is living in her own home with Alzheimer's.
Hey, Lisa, you're cutting out.
So,
Lisa, can you hear us?
I've seen a lot different scenarios with living and not be here maybe they're chakra disability.
Hey, Lisa, if you turn your video off, your sound might play better. You're cut out and we can't hear you. Okay, we might have lost Lisa. I mean, Zoom is Zoom. This happens. So while we're waiting for Lisa to reconnect.
I'm back.
Okay, good.
It's back.
Lisa,
I'm being challenged
please
with the
continue.
digital divide.
Yeah. And sometimes if you stop your video, the sound plays better. Just FYI.
I'm happy if you don't see my face as I'm talking, so that's okay with me. If I start to...
It's cutting out again.
Can you hear me?
Yeah, there you go. All right, now try.
Okay.
No.
Are you there?
Unfortunately, it's still bad.
Are you there now?
Yeah, but it's still break. It's coming in and out.
The other option would be to call in
Okay,
on your
I'm
phone.
taking my picture off. I'm in San Luis Obispo in this little place.
Okay.
Should we switch to questions?
Yeah, why don't we pivot? And
I think I'm back.
Okay, give it another try.
You hear me? Okay, sorry. I think you've read the slide. So more than 1 in 6 Americans are full-time. So next slide, please. One of the things that we sometimes overlook is the middle market gap. And those are people that may not qualify for public assistance because they make too much money or they have assets. They are unable still to afford assisted living or independent living. They're too wealthy to qualify for Medicaid or Medi-Cal. And they really want to stay at home. I think I'm kind of hopeful that the master plan on aging with regards to the Medi-Cal asset level will increase that somewhat so that you don't have to spend down to $2,000 before you can qualify for some of the assistance. You need more than a few $1,000s often to just take care of your home repair. Next slide. It's a big business. I mean, caring for free, if you had to monetize that, it's estimated to be $375 billion a year. That is money that people can't afford, first of all, and money that family members are to some extent absorbing. They're either not being able to go to work, they're taking care of their parents, family members, and so forth. So let's go through. I'm a little rattled, you can tell. Next slide. So at the end of the day, it's really important because what we're finding is that a caregiver living independently, and the research is telling us that living independently is a huge piece of healthy living and long living for most people. As a family caregiver, it is a total challenge because not only are you being called upon to assess the person's health issues, but you're looking at their housing, the transportation, you're looking at their medical situation. When you have to find people to assist somebody perhaps with dementia or chronic illness, finding someone to do medication management is different than finding somebody to help with bathing and the functions of independent living. So the caregiver that is a family caregiver needs so much support. If you do hire through a registry or you do hire an independent caregiver, you have to know how to manage payroll. You have to know how to set the payroll up, your finances. You have to understand their cash flow situation. You're doing the bills sometimes. You're cleaning or finding people to help clean. Those resources are really invaluable. I'm happy to see that the Master Plan on Aging in Section 107 and 109 address that to some extent. So 107 addresses the paid family leave. If you have to take time off to care for a family member, you do not want to find yourself as you age in a financially inadvantaged or disadvantaged situation because you're not earning money, right? You're not paying into the system. You're not saving money. The Section 109 addresses the support for family caregivers and community care. I think that it's good. It'll be interesting to see what kind of support it provides, because often family caregivers are so busy that, unless it's really easy to find, either resources or documentation or things like that, they really don't have time to go Googling through a lot of different links to identify what resource might be best for their family member. The next slide, please. This is kind of just an overview of the different things family caregivers do for family members. And it's basically everything you do for yourself. And you're doing it for another person. And you also have to manage your own life, potentially a family. You might have children. You might have siblings the same age as you that may not be able to even help care because maybe they're working. So it's a huge it's a huge opportunity, and it's a wonderful thing to be able to do, because I don't think there's one family caregiver that ever really regretted the care that they've been able to provide for that family member, but it takes a toll. And I'm hoping that in the next version of the master plan, they'll actually look at that middle market, help people who need to stay in their own homes or want to stay in their homes, and look to maybe some of the nonprofits around the community and support them a little more, because often the difference between staying in their own home and not staying in their own home might be having a driver. It might be having somebody to talk with, to Google that one resource that they need to connect with. And those things are things that some of our nonprofits do well, and the family member can get some relief because of it. So just kind of circling back to the master plan on aging, I think it addresses caregiving. I'm hoping it goes just another step further and kind of focuses a little more on that middle management or middle market piece, the eligibility gap, because honestly, to stay in your own home, your home has to be safe. And if your home isn't safe because you don't have the money to clear out your walkway, to fix your roof, to fix a leak or something like that, you're going to fall. You're going to find yourself calling 911, and you probably will no longer be able to stay in your own home. So it's a huge challenge that we as Californians are faced with, and in Marin specifically, since our population is so much older. And I'm very excited and hopeful that the master plan will help address these things.
Lisa, Aaron, thank you so much. You guys are awesome. We have about 6 minutes for question and answer, and I want to get quickly to some of the ones in the chat from earlier. There was a question from Gwendolyn around statistics, and I'm putting a link in the chat. Findnational.org is an excellent resource per caregiver data. They collect all sorts of stats on all sorts of issues. And so I would definitely check out that resource. And then Gwendolyn's second part of her question, can you discuss pay and recruitment? I will just say briefly for Marin Center for Independent Living, the caregiver pool that we recruit from is typically folks with 3 to 5 years of extensive experience. Again, you know, the pay is out of pocket from the consumer or the family. Our caregivers typically charge between $22 and $25 an hour. They receive all of that. Our program is grant funded. We don't take a percentage. It really goes back to the caregiver. That's our commitment to equity. Many of our caregivers are also IHSS providers, so they are eligible for health insurance. And, you know, that's, again, a partnership where we, Marin CIL and Public Authority, work together to lift up our caregivers. There was another question around share of costs. And Aaron, I'm wondering if you could discuss the issue of share of costs.
Of course. Unfortunately, share of costs is something that is linked to medical. That is something that is, those are decisions are made on the state level. There's nothing that county officials can do about that. What you can do as a constituent is to send letters to your state senator, send letters to your state representative to push them to remove those requirements, because I can agree more. There's people that are, you know, in this bracket, and they are in limbo when it comes to being eligible for social services, and unfortunately, that is causing a lot of problems to our population.
Aaron, thank you. Another question for you, Aaron, is just wondering about the onboarding process of IHSS caregivers, and including background checks, interviews, training, and, you know, kind of what that process looks like.
Sure. The process to become an IHSS care provider is long. The individual needs to go through a background check, to a live scan, and that is linked to the individual. If an individual is arrested, we immediately know. In order for people to be in our registry, we require references. We require an interview, a face-to-face interview. We ask questions. We want to know if the person has experience, etc. I hear you. Unfortunately, there's a lot of people that choose this profession in order to exploit others. In my experience, that percentage of providers is very low. At the same time, I think that these isolated instances are linked to the low wage that IHSS care providers are paid. Marin pays $15.40, and let me tell you, we are the second highest paying county in the state. So with $15.40, it is difficult. It is difficult to demand training. It is difficult to demand these people that are doing it out of the goodness of their heart. I don't know if you guys saw in one of the slides that one of the earlier slides, that the large majority of people that choose this profession do it because they want to help. So what can you do to help this onboarding process? Talk to the board of supervisors, show up during the public comment, and encourage them to increase the wage of IHSS caregivers. Counties set up the wage. Counties have the ability to pay as much as they can to IHSS caregivers. San Francisco pays $17.25, and there's no way why Marin County is not paying the same to the IHSS caregivers.
Aaron, awesome. Thank you. We're not going to have time to answer all questions. Lisa, any final thoughts, comments before we go back? Okay. video isn't working. Everyone, thank you so much. This was a great discussion. Obviously, this is just the start of a longer advocacy and conversation around equity for our caregiver workforce. If you're interested in our work, please continue to follow us, the work of the Aging and Action Initiative. A lot of the grants work being done at the local level, as we've mentioned.